My name is Mariah, and I am a therapist here at Salt Lake Behavioral Health Outpatient Program. I'm going to talk to you about PTSD, post-traumatic stress disorder. PTSD used to be known as shell shock or battle fatigue, and often happens when someone is exposed to a traumatic, deeply disturbing, or life-threatening situation. PTSD can occur whether you directly experience the event or whether you witness it. PTSD symptoms can interfere with everyday living because you have over-exaggerated startle responses, intrusive thoughts, nightmares, phobias, and an inability to interact with your environment socially or occupationally like you used to. A lot of times people hope that these symptoms will simply wear off, but they don't, most times without treatment. If you find that you're experiencing these symptoms several weeks after the traumatic event, you may have PTSD. One of the reservations we see to people seeking treatment for PTSD is the stigma. In fact, there's a push in mental health right now to change it to PTSI, post-traumatic stress injury, so that it's viewed more as a mental injury and less of a disorder, as that more accurately categorizes what you may be going through. Oftentimes, people want to just tough it out and see if it wears off, and what we see is this leads to self-medication, a lot of suppression, avoidance, and destructive relationship patterns. What we want you to know about PTSD or PTSI is that it can be healed. It feels like you'll never get your old self back again, but we've seen time and time again that through effective processing therapy, you can process your trauma in such a way that it neutralizes its effects. It's not that it never happened, and it's not that you forget that it happened. It'll always be part of your story. But it neutralizes the effect of the memory so that it's no longer disruptive to your ability to move forward and live a healthy, productive life. In the outpatient setting, PTSD is primarily treated through group therapy. This is because trauma tends to show up in the body the same way, whether it's childhood sexual victimization, combat trauma, a near-death experience, or a plethora of other circumstances that result in a trauma response. It shows up the same way. What's helpful about that in treatment is that there are some effective strategies we can use in a group setting that create an empathetic and relational environment as you process through your trauma, normalizing your experiences and building off of other people's coping strategies and processing abilities that make it easier for you to move forward in your trauma in the outpatient setting. We know that it feels like when you're in trauma, you're never going to be okay again and you'll never get your old self back. We've had many people coming in saying that they've tried everything and nothing's going to work. And those same people leave feeling hopeful, happy, and whole again. We know that you can too.